esophagus should generate very smooth muscle contractions that move food from the esophagus into the stomach, really without much pause. Esophageal manometry is a special esophageal function test that involves placing a small catheter with some numbing medication in the back of the throat and in the nose. The catheter is placed through the nose down into the throat, and the patient takes multiple sips of water during the procedure. The manometry catheter actually has pressure sensors every centimeter down the catheter length. So when the patient swallows with this catheter in place, we get readouts of the pressures in their esophagus and esophageal sphincter muscles, so that we see really a picture of their swallow. It's incredibly helpful when we're evaluating patients with difficulty swallowing, because sometimes patients have difficulty swallowing because they have a defective swallowing mechanism. Swallowing is a very complex process, and it involves coordination of the swallowing center in the brain with nerves and muscles in the esophagus. And if everything isn't happening in a perfect kind of domino pattern, if things aren't relaxing when they should or contracting when they should, then it can cause patients difficulty swallowing. But it's also very important in surgery planning. We need to understand if patients are going to have maybe an increased risk of having difficulty swallowing after surgery because they don't generate good pressures when they swallow, and manometry helps us identify these patients. The test itself takes 15 or 20 minutes, and the patient doesn't need to be sedated for the procedure. But the good news is that even if there is an esophageal function problem, patients often still do very well with surgery. Sometimes esophageal manometry can help us identify motility disorders such as achalasia that may change treatment recommendations entirely.